So what is a spinal cord injury? A spinal cord injury is due to traumatic injury that bruises or tears the spinal cord. And it is a common cause of permanent disability or death in children and adults. It is also known as an acute SCI, and further down this video, I will be referring to this injury as an acute SCI. So some terms we should probably know before getting into the video completely is that vertebrae are many bones that make up the spine, and the spinal cord is a bundle of nerves that carry messages between the brain and the body, and they are essential for movement and sensation. So what are the causes of an acute SCI? It is mostly common when the area of the spine or the neck is bent or compressed, such as in falls, motor vehicle and sports injuries, driving and trampoline accidents, violence, infections that form an abscess on the spinal cord, and birth injuries. Some of the risk factors for an acute SCI are that the average age for people with an acute SCI is currently at 42 years old. Males suffer more from an acute SCI compared to females. And ethnicity-wise, non-Hispanic whites are at a higher risk. So the symptoms of an acute SCI vary widely. The location impacts what body part is affected and the severity of the impact. The spine may be in shock right after the injury, causing a loss or decrease in feeling, movement, muscle movement, and reflexes. Then the swelling will ease and other symptoms will show up according to the injury's location. The extent of the damage to the spinal cord determines if the injury is complete or incomplete. Well, what's the difference? A complete acute SCI is that there is no movement or feeling below the level of injury. However, an incomplete SCI is that there's still some movement or feeling below the level of the injury. The way an acute SCI works is that the higher up the injury, the more severe the symptoms. For example, an injury to the neck or the first and second vertebrae in the spinal column or the mid-cervical vertebrae, which is right around here, affects respiratory muscles and breathing. However, injury to the lumbar vertebrae, which is your lower back, may affect the nerve and muscle control to the bladder, bowel, and legs, and even sexual function. Therefore, there are two names for injuries to the lumbar vertebrae. One is quadriplegia, which is a loss of function in the arms or legs. Paraplegia is a loss of function in the legs and lower body. So the most common symptoms of people with an acute SCI are muscle weakness, loss of voluntary muscle movement in the chest, arms, or legs, breathing problems, loss of feeling in chest, arms, or legs, and loss of bowel and bladder function. So how do doctors determine if you have an acute SCI? Well, an acute SCI is a medical emergency, so emergency evaluation is needed for any suspected injury to the spinal cord. Therefore, doctors will do a physical exam and diagnostic tests, such as checking your medical history, asking how you got the SCI, blood tests, X-ray scans, CT scans, and MRIs. For further information on blood tests, CT scans, and MRIs, you can take a look at my previous two videos, which talks about headaches and Alzheimer's. They're very interesting. I do suggest you check that out. So what is the prognosis for people with an acute SCI? Well, these people will definitely need physical therapy to retrain the muscles and to prevent muscle wasting and contractures. They may have occupational therapy, which they would help learn new ways of doing daily tasks with physical limitations. They would need frequent medical evaluation and testing, and if needed, they will have a mental health professional work with them. So what is the treatment for an acute SCI? Well, an acute SCI requires emergency medical attention, and the head and neck are immobilized to prevent movement. We don't want the spinal cord to tear even more. So to prevent that, the head and neck, which are very important, are immobilized. Treatment for an acute STI is based on your age, overall health, and medical history, the extent and type of the STI, how you respond to initial treatment, the expected course of the STI, and of course, your opinion or preference. However, the damage that is done by an acute STI cannot be repaired currently. So surgery might be needed. They will put you under observation and medical management in the ICU. You will be given medicine, a mechanical ventilator, bladder catheter, and feeding tube. So we know how doctors will diagnose it, how they will treat it, and what an acute SCI is. But how do we prevent ourselves from getting an acute SCI? Because it is a very dangerous injury. We want to avoid it as much as possible. There is no sure way to prevent it, but then there are many steps to lower the risk, such as drinking and driving. Do not do drugs, do not drink alcohol, and do not drive at the same time. Even if you were tired. If you were tired, make sure you are fully awake before you drive. Always wear a seatbelt. Take precautions to avoid falls at home. Keep firearms unloaded and locked away. And wear a helmet to prevent head injury. The brain is in your head. You don't want your brain to be injured. So what are warning signs of an acute SCI which indicate you should probably call your healthcare provider? Skin sores or infections, trouble breathing, fever, cough, or other signs of infections, severe headache, not urinating regularly, or having severe diarrhea, or having constipation, severe muscle cramps or spasms, and increasing pain. If any of these happen and you know you got hurt, you should check out your SCI with the doctor. However, do note that if you have these, they do not always mean you have an acute SCI. So always go to the doctor to make sure the diagnosis is correct, to have proper diagnosis, before you take any action. Here are my references, and thank you for watching. Don't forget to like this video, subscribe to my channel, and comment down below. I will be reading all of your comments, and I do suggest you check out my previous 2 videos. And I hope to have another video out very soon. And yeah, thank you so much. Bye-bye.